Good afternoon. It is a pleasure to be here. Thanks to the organizers for inviting Dr. Tania Centeno and me. My name is Hugo Mendoza, and I will be speaking on behalf of BoroBoss today. Before we begin, I would like to highlight that talking about everyone involved in One Health in Mexico is not easy, but we will do our best to give you a clear picture. Okay, what is One Health in the Mexican context? Mexico's reality is shaped by a mosaic of socio-ecological factors that demand an integrative One Health approach. These factors are, however, increasingly pressured by land use change, environmental degradation, poverty, and social inequity. Rapid urban expansion accelerates land transformation, increases vulnerability to climate change, and undermines ecosystem services. Of course, corruption, organized crimes, and weak governance further limit coordinated responses, while national One Health policies remain largely absent, even as we face One Health issues such as emerging diseases and antimicrobial resistance. Despite these challenges, Mexico holds enormous potential. We are one of the most biodiverse countries on Earth, with strong cultural heritage and traditional knowledge tied to nature. And of course, our academic and scientific communities are highly capable and motivated to work toward healthier, more resilient social ecological systems. Okay, so who are involved in Mexico? Stakeholders are mainly in government, academia, and communities, and there is almost no private sector involvement. Disciplines span life, health, social, and exact sciences, but operational efforts focus mostly on the health and life sciences within the academia and the government sectors, with zoonosis and antimicrobial resistance as main themes. Like in many other countries, interdisciplinarity is limited, and real transdisciplinarity, that is working beyond academia, is still rare. As a brief aside, and connected to what I just mentioned, I want to highlight that applying the One Health concept often seems to involve only a limited number of disciplines and sectors, not only in Mexico, but around the world. To illustrate this, I will summarize one ongoing research project. To understand how One Health has been applied, we reviewed over 1,000 articles with the phrase One Health in the title. More than a half of these were position papers, including opinion and review articles. In the end, we analyzed over 400 original research articles. Out of these, only 96 addressed all three dimensions of health. 116 covered two dimensions, 109 focused on one dimension, and 135 did not address any dimensions at all. This suggests the existence of a phenomenon called One Health washing, whose implications I will discuss later. The results of multivariate analysis showed that government institutions and health sciences tend to prioritize human or human-animal health, while studies covering all three dimensions are mostly led by academia. Environmental health remains the least addressed. Research about themes are led by zoonosis, while antimicrobial resistance, non-communicable disease, and food security appear mainly in studies that attempt broader integration. This highlights how fragmented and uneven the approach still is. I think many processes could benefit from a One Health approach, but any proposal to apply it needs to consider all three health dimensions, rather than just following the trend. Returning to the map of sectors and disciplines involved in Mexico, let me start with the role of government. Mexico has no national One Health strategy or law, though there are isolated efforts. The National Service of Health Safety and Agri-Food Quality, SENASICA, works on animal health and surveillance, while the National Institute of Public Health on public health and governance, and the Center for Food and Development Research on food safety, sustainability, and ecosystem health. Other agencies mention zoonosis and antimicrobial resistance in their web pages, but lack clear programs. Education on One Health is still quite limited and usually happens through brief workshops and webinars. Uh, and as a recent study concludes, we have sectoral advances but no unifying framework, with barriers like institutional fragmentation, weak coordination, and little information exchange. And I think this is the main problem. Um, the institutionalization of One Health in Mexico will require policy harmonization and professional training, and of course, a sustainable funding. Now let's talk about the academia. The academic sector is the most visible driver of One Health in Mexico. The list here comes from quick searches and known colleagues, but we are sure many more are involved. So far, these researchers are affiliated with only 12 academic institutions. Geographically, they are mostly concentrated in northwestern Mexico, shown in green, in the central region in orange, in the south in yellow, and in the Yucatan Peninsula in blue. The northern and northeastern regions of the country appear underrepresented, not because work is not happening there, but because we currently lack information about groups operating in those areas. This is largely due to limited connectivity between research teams, and at the end of the presentation, we will suggest a potential way to address this. In addition to these institutions and researchers, are also there is also an engagement in education. However, formal One Health courses are still very limited. To our knowledge, there are only 3 structured courses, 2 integrated into university programs, and 1 diploma course aimed at professional from related fields. At the level of scientific research and peer-reviewed articles, Mexican scholars have developed both direct One Health approaches and countless studies that engage the concept indirectly. Publication includes work on vector-borne diseases, research on bats and the implication of coexistence with humans, and studies of trypanosomiasis in southern Mexico. A substantial body of work has also emerged from binational Mexico-US collaborations focused on health issues along the border. In addition, several studies explore how global and climate change influence the risk of rodent-borne diseases, linking ecological processes to public health concerns. Antimicrobial resistance has been another major topic, with a growing number of studies framed within the One Health perspective. Equally important are the social dimensions. I want to highlight this innovative approach that analyze community dynamics and governance in vector-borne disease management. Sorry. And I would like to highlight also this excellent article on One Health governance in Mexico, whose conclusions about limited governmental commitment and the need to stronger policy integration connect directly to the points we discussed earlier in the presentation. And what about the community-based projects? Civil society work is harder to document. It may be limited or simply underreported. Still, some NGOs do meaningful work. Salud Socioecosistémica, Socio-Ecosystemic Health, is an NGO focused on environmental education for health, and they work mainly through workshops and research projects in both formal and non-formal education system. I am part of this NGO, and if you are interested, you can contact me later. Recrea Tu Mundo focuses on environmental health as a key part of global health, creating educational materials for children that help them connect with and respect the environment. Isla Urbana addresses one of the most critical dimensions of health: water management through rainwater harvesting and education programs in marginalized and indigenous communities. And finally, CALANCAF, founded by Dr. Gerardo Susan, a pioneer in disease ecology and One Health in Mexico, has for many years conducted ecological and social research on zoonotic diseases in the context of global change. And as I mentioned before, for the private sector, there is essentially no explicit One Health activity. Now I would like to talk about international collaboration, which has been a key foundation for One Health research in Mexico. Several Mexican institutions, including UNAM, the University of Yucatan, CIMBESTAF, the Institute of Ecology, SENACICA, and the National Commission of Protected Natural Areas, the CONAMP, are actively working with global partners. For example, there is the German Latin American Center for Infectious Research and Glacier, as well as multinational projects like SOI, PRESOD, and the Selva Maya One Health Alliance. Collaboration is also fostered through agencies such as JIC and the IRD and ICA, and through networks like the Wildlife Disease Associations. Universities including UC Davis, Tulane University, and the University of Chile are key partners as well. And of course, the North America One Health University network provides a new platform, for regional exchange and cooperation. As a way of concluding, One Health is more than just a technical tool. It represents a cultural and political shift in how we understand and act on health. In Mexico, there are efforts underway, but they remain fragmented, with limited federal institutionalization, with academic sector driving innovation, yet often work in isolation. Some key challenges in Mexico include fragmented governance, scarce resources, limited training, neglected of environmental health, and little cross-sectoral or transdisciplinary collaboration. But despite these challenges, momentum is building. Our plan is to first identify and connect the different groups and stakeholders working on One Health across Mexico, including academic institutions and other sectors. This national network will serve as a foundation, helping to coordinate efforts within the country and ultimately reinforcing the North American One Health University network. Finally, our goal should be to move beyond merely adopting One Health and toward truly transforming how we link human, animal, and environmental health. Thank you very much for your attention. See you later.